Hello students, I am Dr. Priya Roy from Department of Anatomy, KIMS Karad. Today I will discuss about the paranasal sinuses. When we will use the term sinus, please don't confuse with it other sinuses present in the body. Sometimes by confusion we can write about the other sinuses if the question is asked to enumerate. What are the other sinuses? The other are dural sinuses, dural venous sinuses, and these are known as the air sinuses. So today we will discuss with the paranasal air sinuses. Please be attentive throughout the lecture because while in between I will tell you about the more important points which are important the aspect of the examination and the keywords which are asked in the MCQ questions. Okay, so we will start with the paranasal air sinuses. Air sinuses are named according to the bone in which they are present. Just as you can see that in the frontal bone, the sinuses are named as the frontal sinuses. And in the maxillary bone, they are named as the maxillary air sinuses. Same as in the sphenoid bone, they are named as the sphenoidal sinuses. And in the ethmoid bone, they are named as the ethmoidal sinuses. They are the air spaces. So the bone in which they are present, they are known as the pneumatic bone. They are lined with the respiratory mucosa, which is pseudo-stratified columnar ciliated epithelium. The cilia beats towards the opening of the sinuses so that the secretion will drain. It helps in drainage of the secretion, otherwise it will accumulate and the infection may arise. The sinuses are rudimentary at birth. All the sinuses are present at the time of birth except the frontal air sinuses. Always I am just including the term air, so you should not confused with other sinuses. The growth of the air sinuses exhibit two spurts, namely during the 6 to 7 years, that is during the eruption of the teeth, and second at the time of puberty. Till adulthood, growth due to growth of the bones. Latter, resorption of surrounding cancellous bone. So in this you can see the location of all the sinuses. So you will see that in the lateral view you can see all the sinuses. In the front view you cannot see the ethmoidal, that is ethmoidal sinuses you can see in both, but the sphenoid sinuses that is within the sphenoid bone is not seen in the front view. Frontal sinuses, maxillary sinus, ethmoid sinuses, and the sphenoid sinuses. What are the function of paranasal air sinuses? They are helping in humidifying and warming the inspired air. They help in the regulation of intranasal pressure. Because they are present, their bones are very air containing, so they are lightening of the skull. They give resonance to the voice. They are behaving as absorbing shock absorber, and they contribute to the facial growth. So these are the function of paranasal sinuses. Now we will start with the frontal sinuses. Obviously, as the name indicates, they are present in the frontal bone. They are absent at birth, start developing at the second year, and seen clearly at the age of 4th year. The height of the frontal sinus is 3.2 centimeter. The breadth is 2.6 centimeter and the depth is 1.8 centimeter. The numbers are 2. All the sinuses are present in pairs except the ethmoid sinuses. They are present on both sides 3, that is anterior, middle and posterior ethmoidal sinuses. Frontal sinuses present beneath the superciliary arch. Its posterior wall is thin and separates sinus from meninges and frontal bone. Floor is related to orbit. It extends backward into medial part of roof of orbit. It opens into middle meatus of nose at anterior end of hiatus semilunaris by frontonasal duct. So this is very important MCQ question, that where the frontal sinus will open. So question can be asked in which meatus, that is it opens into middle meatus at the anterior end of hiatus semilunaris. It is better developed in male. Arterial supply is by supraorbital artery, which is a branch of ophthalmic artery. Do you know ophthalmic artery is a branch of which artery? It is a branch of internal carotid artery. Vein drains into anastomotic vein between supraorbital and superior ophthalmic vein. Lymphatic drainage is to submandibular node. Nerve supply is through supraorbital nerve. So can you tell me, supraorbital nerve is a branch of which nerve? Yes, it is a branch of frontal nerve, which in turn is a branch of ophthalmic nerve. Ophthalmic nerve has 3 branches: frontal, nasociliary and lacrimal. Now we will see the maxillary sinuses. This is the most important sinus and the most important question to be asked in the examination. So you learn it by start to end point. Each and every word is important. The synonym of the maxillary sinus is antrum of Highmore. It is the largest of the sinuses, first to develop around the 17th day and very well seen in the 1st to 2nd year, and develops to adult size by 2nd decade. It lies in the body of maxilla, 15 ml in capacity. The shape of the maxillary sinus is pyramidal. Base is towards the lateral wall of the nose. Apex laterally in the zygomatic process of maxilla. Where it apex, it is pyramidal, and apex lies in the zygomatic process of maxilla. So height is 3.5 centimeter and anteroposterior is 3.525 centimeter and transverse is the 2.5 centimeter. It opens into middle meatus of nose at the lower part of the hiatus semilunaris. So all the openings of the paranasal air sinuses are important. Which sinus opens into which meatus? So you can see in the picture the presence of maxillary sinus. What important point we have discussed earlier? It is pyramidal in shape and apex is here. Apex is here towards the zygomatic process. So afterwards we will see the other boundaries of maxillary sinuses. Apex is towards the zygomatic process of maxilla. The base is towards the nasal surface of body of maxilla, and in the disarticulated skull base present a large opening, the maxillary hiatus, which is reduced by uncinate process of ethmoidal process of inferior nasal concha, descending process of lacrimal bone, and perpendicular plate of palatine bone. So base, which is the nasal surface of body of maxilla. So here 4 bones surrounds the opening of the maxillary hiatus. 4. That is, one is uncinate process of ethmoidal process of inferior nasal concha, descending process of lacrimal, and perpendicular plate of palatine bone. So if I have put picture of orbit so that you can realize that here is the maxilla. So which are the bone present that is growing downwards? So we have seen the lacrimal bone that is also contributing, that is the ethmoidal bone, uncinate process of the ethmoidal bone, and more posteriorly you will see the palatine bone. Okay, and below that you have seen the inferior nasal concha. So these are the 4 bones which are growing downwards. So you can see, imagine that how the 4 bones will reduce the space of the, that is opening of the maxillary air sinuses. Here also this is the same, this is the maxilla, and you can see here the 3 bones, lacrimal bone and the ethmoidal bone, uncinate process, perpendicular plate of palatine bone. Okay, so these are the bone, and here you can see the inferior nasal concha. So these are the bone that forms the boundary of the opening of the maxillary air sinuses. Here you will see this area in magnified view, that all these are the 3 concha. This is the inferior nasal concha. So this is only here, the maxillary air sinus is this area only. So these are the things, that uncinate process, inferior nasal concha. Here is the uncinate process, and all the palatine, lacrimal and ethmoid bone. So these are the 4 bones. Roof is formed by the orbital surface of maxilla traversed by infraorbital vessels and nerves in a bony canal. If you will remember that here the infraorbital foramen is present, and in this the infraorbital nerves and vessels travels. Floor is by the alveolar process of maxilla, that is 1.25 centimeter below the floor of nasal cavity. Anteriorly it is related to infraorbital nerve and posteriorly it is related to posterior-superior alveolar nerve. So here is the maxillary sinus. So this one is the base, here is the floor, and this one is the apex, roof. So you can see here the orbital wall. This is the infraorbital canal. Arterial supply of the maxillary sinus is through facial, infraorbital and greater palatine arteries. Venous drainage is through facial vein and pterygoid plexus, lymphatics into the submandibular nodes, and the nerve supply is to infraorbital nerve and the three superior alveolar nerve, that is the anterior, middle and posterior superior alveolar nerve. Now the sphenoidal sinuses. It lies in the body of sphenoid, develops 4-5 months of life, well seen at third year, and adult size in second decades. They are 2 in number and 2 centimeter in height, breadth is 1.5 centimeter and depth is 2 centimeter. It opens into the sphenoethmoidal recess of nose, that is superior to superior concha. Superior to superior concha. So location of the sphenoethmoidal recess is sphenoethmoidal recess. It is superior to superior concha. Sometimes students will confuse, so you have to remember that this one is sphenoethmoidal. Opening of the sphenoidal sinus is sphenoethmoidal recess, that is the superior to superior concha. Now the relations. Superiorly, if you will remember the sella turcica, so below that there is the sphenoidal sinuses is present. So superiorly, optic chiasma and pituitary gland on both sides, internal carotid artery and cavernous sinuses. Inferiorly, nasal cavity is present, and in front it is sphenoethmoidal recess. You can see here. So this area is sphenoidal sinuses, and you will see that this is the pituitary gland in which it lies, this sella turcica. So in the relations we have seen that superiorly optic chiasma is present, and pituitary gland. Here is the sphenoidal air sinuses, on both sides cavernous sinus and internal carotid artery is present. These are the relations of the sphenoidal air sinuses. Below it is the roof of nasopharynx, and behind pons and medulla oblongata. Arterial supply is by posterior ethmoidal artery. Venous drainage, corresponding veins, lymphatic to the retropharyngeal nodes. Nerve supply is through the orbital branch of pterygopalatine ganglion and the posterior ethmoidal nerve. Now the last, ethmoidal sinuses. They are the intercommunicating space in the labyrinth of ethmoid begins to develop 5th month and completed by the 4th to 5th year. Completed from above by orbital plate of frontal bone, from behind by the sphenoidal concha, and from front by the lacrimal. So the orbital plate of frontal, sphenoidal concha, and posteriorly that from front by the lacrimal bone. Anterior ethmoidal sinuses opens into hiatus semilunaris. Middle sinuses into bulla ethmoidalis, means both into middle meatus. Posterior sinuses into superior meatus. One HeLa cell is the ethmoidal air cell variant present into floor of the orbit near the natural ostium of maxillary sinus. Arterial supply is through anterior and posterior ethmoidal artery. Venous drainage through respective veins. Lymphatics into the submandibular and retropharyngeal nodes. Nerve supply, anterior and posterior ethmoidal nerve, branch of pterygopalatine ganglion. This is the surface representation of all the sinuses. I have told you earlier that laterally you can able to see all the sinuses, maxillary, frontal, ethmoidal, and more posteriorly in the depth the sphenoidal air sinuses. Now what left is the applied aspect related to the sinuses. Most important is the sinusitis. Sinusitis is the inflammation and swelling of the mucosa of one or more of these paranasal sinuses. Most common is the maxillary sinusitis. The main presentation is the headache and persistent thick purulent discharge from the nose. It can arise from the infected nose or may from the secondary reservoir purpose from the frontal air sinuses or other sinuses. The pain in the maxillary sinusitis is referred to upper teeth. The most common causes of maxillary sinusitis, it can arise from dental caries. So another is ethmoidal sinusitis. It can arise secondary to other sinusitis. The infection can spread to orbit. Next is the sphenoidal sinusitis. It can affect pituitary gland and optic chiasma. Obviously, because we have seen that superior relation of sphenoidal sinus is the pituitary and optic chiasma. Diagnostic purposes, we can take the radiograph CT scan of the skull and see the, because normally it can present, normally X-ray it can present as the translucent, but if any infection is there, opacity is present. And also another thing, that there is transillumination test. These are the location of all the sinuses in X-ray. That is the nasal septum, frontal sinus, maxillary sinus 3 number, fourth is the ethmoidal sinus, and one more thing, that here always X-ray odontoid process is visible, so you have to X-ray recognize it. In the diagnostic purpose, that X-ray taken taken for the maxillary sinus is known as the water's view. So it appears like this. The X-ray beam is angled at 37 degrees to the orbitomeatal line. The rays passes from behind the head and are perpendicular to the radiographic plate. It is commonly used to better view of the maxillary sinuses. So the name of the X-ray is water's view. Patient present like this and beam is from this side. And his chin view is taken in such a way that chin of the patient touch the film while X-ray beam is projected from behind. Water's view with open mouth is preferred as it shows the sphenoidal sinuses. So lateral view, these are the things that are asked in examination. So obviously if it is the sella turcica, so this one is the sphenoidal sinuses. Here is the frontal sinus. Here is the frontal sinus located. This one is the maxillary sinus. So in the X-ray, examiners can point out to identify all these structures. Transillumination is also one of the diagnostic tests for the sinusitis. Can palpate the sinus area. Infection of the tooth may spread to maxillary ear sinus. Infection from frontal and anterior ethmoidal ear sinuses may accumulate in the maxillary ear sinus through the hiatus simulinaris. The carcinoma of the maxillary sinus arises from the mucous lining of the sinus. So the growth of the carcinoma, according to that, symptom will arise. Upward invasion into the orbit displaces the eyeball, causing proptosis or diplopia. Involvement of infraorbital nerve produces pain and anesthesia in the skin over the face below the orbit. Downward invasion into the floor produces visible bulge or even ulceration of palatal roof. Medial will encroaches nasal cavity and causing obstruction, maybe epistaxis. Laterally, swelling of the face. Backward may be involving the palatine nerve, leading to severe referred pain in the upper teeth. Sphenoethmoidal ear cell, also commonly known as the Onodi ear cell, is an anatomical variant of the paranasal sinuses, important due to close proximity to the optic nerve and internal carotid artery. This is a variant, mainly the posterior most ethmoidal, sometimes known as the Onodi ear cells. Tripod fracture. So three fractures are there: arch of zygomatic bone, zygomatic process of frontal, and zygomatic process of maxilla. So bones are zygomatic, frontal and maxilla. Zygomatic frontal, so this is known as the tripod fracture. And this also sinus will. So what is the drainage of the secretion? How the secretions are drained? One is the antral puncture, antrostomy by using trocar and cannula, which are passed below the inferior nasal concha in an outward and backward direction. Here is the inferior nasal concha and the trocar is passing below it. And second is the approach through the canine fossa in the gingivo-labial sulcus, that is known as Cardwell-Lewick operations. So at the first MBBS level, you should know only the names and what is the, in one line, what is the process going on. Don't go into detail, only the applied anatomy part. The detail you will study when you will go for clinical classes. So hope you have understand all the air sinuses. So today we have discussed only the paranasal air sinuses. Thank you so much for listening so patiently.